One of the most common skin problems we see in dogs, especially during the spring and summer months, is skin disease caused by allergies. Flea allergic dermatitis, an allergic hypersensitivity to flea saliva, is very common, but atopy, an allergy to inhaled allergens like pollens, is also very common and can cause intense scratching. Other common allergens, not necessarily seasonal, include foods, tobacco, house dust, mites, wool, feathers, and many molds. We can often tell a lot from the location on the body that seems to be most affected. With atopy, for example, the lesions seem to be more concentrated in the groin area, near the lower back, thighs, and feet, and also around the face and ears. The skin will become red and inflamed, and the intense scratching often causes skin sores and scabs. Since many dogs allergic to pollens will also have other allergies, there can be a lot of overlap, especially with flea and food allergies. A complicating factor with many skin allergies is a secondary skin infection that can start once the skin is inflamed from the allergy. Skin infections also itch, which contributes to the very common itch-scratch cycle, which must be treated. Allergies can't be cured, but they can be controlled. Our goals of treatment are to reduce the clinical signs, the itching and the discomfort, and the secondary skin infection while we try to identify what might be causing the allergies. Obviously, one can try to practice avoidance with allergens like foods and even fleas, but it's pretty tough to avoid pollens and other environmental allergens. Identifying what triggers the allergy is often a challenge, and veterinarians have their preferences as to what allergy tests they like to use. Ideally, we like to try to identify the offending allergens with tests, the most common being a skin scratch test or a serum allergy test. Both have their pros and cons. The scratch test, the original industry standard, is usually done by a dermatology specialist, requires much expertise, and if considering, a pet needs to be off of allergy medications for several weeks prior to the test, as they may interfere with the results. This test, however, is still considered the most accurate. The serum allergy test is a blood serum test and can be done by a general practitioner. Allergy medications will not interfere with the results, so there's no need to have any waiting period. This test is a bit less specific than the scratch test, but because of its ease and convenience, it has become very popular. Based on the allergy test results, we'll follow with hyposensitization at home, which can be done with a regimen of injections, just like the allergy shots many of us used to get as kids, or with newer liquid drops, which are placed under your dog's tongue. Hyposensitization isn't always effective or practical for some pet owners, but it is the best method of treating allergies at their source. In many cases, while the hyposensitization procedure is building a pet's immunity, or when it just isn't an option, we may need to treat the current clinical signs, relieving the itching and controlling the skin inflammation and infection. Though corticosteroids may be effective at reducing allergy symptoms, their potential side effects may make their use problematic, especially if needed year-round. So we recommend using medicated baths, skin and coat supplements with omega-3 fatty acids, antibiotics for secondary skin infection, controlled doses of oral cortisone-type drugs under close monitoring, and occasionally antihistamines, which are actually more effective at calming a pet than they are at treating the allergic response. A medication aimed at suppressing a dog's immune response to allergens, thus minimizing the clinical signs, is occasionally recommended, while a newer medication, which actually blocks the allergic response and symptoms at the cellular level, much like an antihistamine does for people allergies, is showing great promise. Though these treatments will make a world of difference for your very uncomfortable pet, I encourage allergy testing and hyposensitization as the best method to treat and control pet allergies. So if your pet seems to be scratching certain areas like crazy, or has been having persistent or seasonal skin problems, chances are he or she may be suffering from allergic dermatitis. Allergies may not be curable, but they certainly can be controlled. Reporting for Pet Care TV, I'm Dr. Jeff Werber.